I'm going to introduce you all to something very important, and that's the WPATH Standards of Care, more specifically the most recent one, the WPATH Standards of Care version 7. This is the worldwide standards of care for transgender people. Even though your doctor may not follow them specifically, there's also the Harry Benjamin Standards of Care, which is an older model. Even if your doctor is following that one, you can at least introduce them to this model or tell them about it. Because there's some major issues with Harry Benjamin, and WPATH is a little more updated, and most of all, it's a little more relevant to the person accessing care. The WPATH Standards of Care version 7 is a lot more client-centric. This means that it's focused on what the practitioner can do to help the client, rather than what the client needs to do to prove to the practitioner that they can go on hormones. Also, there's a lot of more flexibility built into this one, and that's in the form of recognizing unique situations. This means that even if you don't meet the requirements set out by WPATH, there is still some wiggle room because, of course, humanity is very diverse, so it would make sense if our standards of care for medical practice were diverse as well. Also, a clear statement that gender nonconformity is not pathological. This means that it's not a disease, it's not something that's problematic. It's just something that people may need medical intervention in order to feel better about themselves or align their mind with their body. Also a clear statement that psychotherapy is not necessary. Neither is any sort of therapy in terms of accessing hormone therapy. This means that anyone who's a qualified assessor can do the assessment. You don't need to go to gender therapy for an allotted amount of time beforehand before you access gender-affirming care. In a lot of places you can access your GP directly and get them to do an assessment for you if they're comfortable. If they're not comfortable, there are ways around that we'll talk about later. There's also a really key statement in there that being genderqueer or gender nonconforming is also grounds for going on hormones and accessing gender-affirming care. This means that somebody doesn't have to prove that they identify as male or identify as female before accessing hormones. This was a huge problem back with Harry Benjamin's Standards of Care, and that there's often a concentration around proving yourself to be male or female. That doesn't exist anymore, and you can go into a doctor's office and say, hey, I'm genderqueer, I would like to access hormones, or hey, I don't feel like I fit between either male or female, or hey, I identify as third gender, I want to access hormones, and that's perfectly okay under WPATH. And it's important that people know this so that they can advocate for themselves in case their doctors don't know these things. Criteria 1 is persistent, well-documented gender dysphoria. And this doesn't mean that they give you a mark depending on how long you've been gender dysphoric. This just means that your gender dysphoria has been something that's been going on for a substantial period of time. In essence, what this means is that you didn't just wake up that morning and go to the doctor and are talking about hormone therapy then. They want to make sure that it's something that has been in your life for a reasonable amount of time. This amount of time isn't really regulated, it's just a conversation you have to have with your doctor or your assessor. Number 2 is the capacity to make a well-informed and consented decision in terms of your medical treatments. And this just means that you have the ability to consent, and that's usually sort of decided on whether or not you are cognitively able to make decisions. Most people are, and it's sort of a process of informing you of what testosterone is. So that's usually assessment conversations that your doctor might have with you in terms of what testosterone is. Do you understand what it will do? Do you understand the risks, the benefits, and how do you feel about these things? Number 3 is the age of the majority in a given country. This doesn't mean that the majority of the people are your age, because that would be impossible. What this basically means is that you are considered a legal adult. In most places, this is 18. Number 4 is if persistence, medical or mental health concerns are apparent, they must be reasonably well controlled. Very few people, if anyone, really, I think no one, is denied access to hormones. It's just that some people will have to take a few more steps in order to get to a place where they can safely access hormones. Next is where you can go to access hormones. Essentially any GP, which is like a general practitioner, so that could be like a family doctor, can prescribe hormones. They just have to have the pre-existing training in terms of how to assess someone for hormones, which not a whole lot of doctors have. In that case, you can actually ask your doctor if they would be willing to go through that process of learning how to assess for hormones and treat transgender patients for you. To do this, they can contact other doctors who have that experience and sort of learn from them. And some places, a thing like a Raceline might be available. Raceline is specifically for Vancouver. It has an unfortunate acronym, but what it means is rapid access to sort of like to consultative. Almost got it. Basically rapid access to consultation. I don't know what the E stands for, I've forgotten. And that's basically a hotline that doctors can call and ask, hey, I have a transgender patient, I'm not sure what to do, what should I do? And someone who specializes in that can help them out. And it's sort of like a free exchange of information between practitioners. You might have a version of that in your area. It's not to say that people outside the province, or I think the country as well, can call the Raceline, but it's sort of, it's suggested that if you do have something similar in your area, which I assume many health authorities do, then you should go to that first. I'm just using the Raceline as an example because it's the one I'm familiar with. You can also go to see an endocrinologist, but an endo will require a letter. So that's usually a therapist letter or a letter from someone who has done some sort of assessment beforehand will then refer you to the endo. This is my handy dandy cheat sheet. In terms of where to actually go to access hormones, the information in terms of transgender-friendly doctors is sometimes available online. Depending on where you live, though, this can be a little more difficult. For example, Vancouver, pretty easy to access. For Manitoba, I wouldn't even know where to start. I'd probably just Google it. So basically, if you Google, say, if you live in Manitoba transgender doctors, you might find some results. Otherwise, there are usually centers in provinces, states, and areas that you can go to in order to be referred to somebody who is going to be a transgender-friendly doctor or practitioner or surgeon.